Good evening. My name is Chris Thornley. I am the chair of the Board of Health. Today's date is 8/11 of 21. Time now is approximately 6:24, and we have called this meeting to order. This meeting is being conducted and recorded and will be available to the public in compliance with all state law. We are all attending this meeting remotely, and please remember to mute your microphone when possible unless you are actually speaking. Anyone participating remotely, which is all of us, should state their name and title. The three of us don't really need to do that at this point. At the outset of each occasion, person is talking. If there are any votes, which there will not be this evening, it would be taken by roll call, and there will be no chat feature enabled during this meeting. There will be public participation, which I have not received any written comments from the public, and nobody else has called in. I think I touched everything. And this meeting is conducted in real time. Thank you, everybody, for coming on. We will go to the first order of business, which, as stated, public participation, which I received no comments and nobody else has logged on. So we will just continue right on our agenda. Our next order is approval of the minutes from our previous meeting of July 14th of 2021. I have read the minutes and I will motion to approve the minutes. I need somebody to second, please.
Second.
Okay. And Mary?
I agree.
Okay, excellent. Votes carry unanimously and the minutes are approved. We'll at this time turn the meeting over to Nancy in just a moment. We, due to minimum quorum requirements, which we are at, have decided to amend the meeting minutes this evening. We will not be going through every piece of it. We will just be talking a little bit about the COVID status, which is under F number 1, and the G number 2, which is COVID-19 vaccine clinic back to school. So Nancy, if you can just touch a little bit upon them. And then if part of the strategic planning, if there's anything specific, Nancy, that you want us to think more about between now and next meeting, that would be really great for you to put together. And it doesn't have to be right this second, obviously. But if you could put something together in the next, let's say, several days to a week, and then email everybody on the board, so that way we'll have an idea of where your thought process is, and then we can review that particular material with a little higher degree of scrutiny.
Okay.
That would be really great. And the rest of it we'll just kind of thumb over, and hopefully we'll have full participation for our next meeting, and have a bit more of a discussion about the strategic plan.
Okay.
So Nancy, go ahead. Thank you.
All right. So I'm just now, the first one was a status report for ongoing COVID pandemic. So let me start with just, this is information I pulled off from the state website, as well as I've been looking at information from the CDC. They have the CDC publishes information on the county level for each town on transmission in that county. And so Fairfield County has a substantial level of transmission right now. The next level is high, and New Haven happens to have high transmission levels. So now what does that mean for us? Right now here in Monroe, we have between 1 and 2 new positive cases per day. So the state, in their wisdom, they really think that, a lot of other towns are going to go up to and regions will be in the substantial level of transmission. So,
Have they distinguished in any of the reports coming out if it is, shall we say, regular COVID versus any of the variants that are out as of now?
oh, it's
Or
a
is it
lot of
still
it is
being classified all as COVID?
yeah, it's all classified as COVID.
Okay, so you're not getting any particular items on the Delta variant or the Lambda variant or anything like that?
Well, when they talk about transmission, they're talking about COVID in general. The
Okay.
variants are, yeah, so that's just blanket. But the variants are absolutely increasing. That is the predominant variant in the United States right now, Delta variant. So
People are getting, oh, they're not told what variant they had. So I'm not sure how much of that is an assumption because it's not truly tested and reported in the lab. But you can't find data that says there are this many of each type of variant in the cases that are reported. You can't find that. So I'm not sure how they report that.
my experience is
There's
that
no data that is reported that shows it. You can't find it anywhere.
it's probably not publicly available. I know that the state health department calls me and they'll say, you have one, a case that's a Delta variant, they'll let me know. And I'm certain that they have tabulated data somewhere. But I don't have those numbers, but I can get, I can call our epidemiologist tomorrow and try to find out what that is specifically for Monroe.
Well, at this point, I would say let's just, you can do that a little bit closer to our next meeting. That
Okay.
way, because as things evolve, which I'm sure they were, or excuse me, will over the next several months, especially with, doesn't seem like it today, but things will start getting cooler quickly and
Right.
everybody will start returning indoors. So maybe the transmission rates will start to go back up again. So that we at least as a board have a little bit of an idea of how that's going. So nothing that you need to worry about as of right this minute, but
Well-
definitely if you can't get some additional information for our next meeting would be great.
Okay. So just
Something I've experienced professionally is that people are seeking their people are seeking a third vaccine, a booster. They want it because they're hearing in the news that it might be needed. And they're calling to find out how they can get it, and they can't because it's not approved yet. There's no protocol for it yet.
right.
And people are calling saying, but I have cancer and I'm vulnerable and it's been more than 6 months.
I know.
And the only thing I can say is, I'm sorry. They're like, I called the pharmacy where I got my first two, or I got my first two at the hospital. How do I get my third? You can't. I'm sorry, but you'll have to wait. That's not available yet. It's tough.
It is difficult.
You might start getting those calls from people that got them through the health department. They got 1 and 2. Now it's been 6 months and they're looking for the third.
We did. Yeah. Barb was just saying that she's gotten calls. How
Yeah,
many?
I feel bad for people
We got a
because
couple calls.
they're starting to panic.
So, well, yeah. The other thing I wanted to tell you that vaccinations here in Monroe, we've got, it's like 73.7% that have received at least one dose. And fully vaccinated are 65.2%. So, I'd love to get those that need that second dose to get them in, but it's difficult to track people down. And many times they've received their vaccine in another town. So,
well, and now that it's so widely available at pharmacies,
yeah,
I would not be at all surprised if people who received their first when they were available in the town clinic received the second when it was available at Walgreens.
Right.
You know, it was easy and convenient. It wasn't a limited time. You know, it wasn't only available from 9 to 12 on Thursday morning.
Sure.
It was available whenever they walked in at Walgreens. So you didn't even need an appointment in some places.
Right.
So I think a lot of people got their second one. They just had to go in with their first card.
Now,
And in fact,
yeah.
like I know somebody who was doing a travel nursing assignment. She got her first at Walgreens in Oregon and her second when she was back home in Connecticut 4 weeks later at Walgreens. And it was right in their computer system. So that makes it very easy and convenient.
Yeah.
And it still makes the goal of completing vaccination. And if it's in is it the VAM system? You know, if it's in there, it should still show completion based on the person's social security number and all of that.
Right.
But like, it can't just be the list of here are the people who had vaccine number 1 on this date, and now it's been more than 4 weeks and they didn't come back to us, as long as they were back somewhere.
Right. And lots of times, well, we've had a number of cases where someone will get a first dose somewhere else. We don't know about it, and they didn't enter it in VAMS where they got that first dose. So they come to us and we give them a first dose. So really, our first dose is a second dose. So it's the system's not perfect.
They're the people that can get a third dose. Now they're going to come back and they're going to say, hey, you were here 6 months ago. And they're going to say, oh, yeah, I forgot. And they're going to get their third. Tricky. They were planning ahead.
I know. So I met with Joe Kosva. Night before last, we had a meeting and we were talking about the Board of Ed, what's going to happen. Well, you might know that that the governor's order covers mask wearing through the end of September. So our little group kind of decided we'll wait and see. There's nothing more to discuss on mask wearing in schools. I also posed that maybe we can have a back to school clinic for those that are older than 12. And we talked about that. And so he is going to send messaging out to parents to see if there are those parents that want their kids to be vaccinated. But this is kind of, I don't know if this is going to come to fruition because the testing is so readily available out there. And we had a clinic at the end of the school year last year, and we had about 200 kids. So
a clinic for vaccines or a clinic for testing? Because you just said testing is readily.
I'm sorry, to provide the vaccine.
Yeah. I'm surprised it was only 200.
Yeah. Well, there was 400 that signed up for it with us, but only about 200 actually came to receive the vaccine. And I think there were many reasons for it. One was graduation the next day. There was a lot of distractions happening at the time, but we wanted to get, as soon as we were allowed to have to provide this vaccine to kids, we just moved ahead on it. And then a lot of, sorry?
Is there a contingency plan that if it's approved for like the 6 to 12 age groups that it will be offered in school?
I'm hopeful. I'm hopeful, yes.
I got my in school in 3rd grade. I'll never forget it. Because the rubella vaccine came out when I was in 3rd grade.
Mm-hmm.
And we were lined up in alphabetical order in the gym. It's the first time in my life I got a shot and didn't cry because I didn't want to be embarrassed.
Oh, I remember as a kid getting shots in school all the time. Do you, Barb?
Yes.
Yeah.
It's the only one I ever got in school. I had the other childhood diseases.
Mm-hmm. Mm-hmm.
I got my smallpox at the doctor, and I had all the other childhood diseases. I did get TB tested at school a couple of times.
Yeah. Yeah.
But
so this is pretty much the update that I have regarding COVID. Do you guys have any specific questions? Like, I am going to look up to see what the state
so
has.
how many cases do we have in town right now?
Active, well, I can just tell you that it's about 1 a day that these cases are coming in. A couple weeks ago, we had a family of 4 to 5 people that were, I think 3 out of the 5 were positive, which jumped up our numbers for that week. So for week 1, we had 13
Yeah, but
people.
if it's one more a day, then there's somebody who's resolving also, you know, with time.
Yeah, well, the
So-
data that we get, it just tells you how many people are positive from the test. It tells you,
Yeah.
your new cases. It doesn't measure
Right.
prevalence.
But old cases are resolving with that time too.
Yeah. Yep. Yep. But that's pretty much it on that. Chris, do you want me to add anything more? Any questions?
No. I think it was good, good information, and Mary had some really good questions. I kind of liked them, and I don't know personally. I don't have any obviously children in the school system anymore, but I certainly have mixed emotions about mask mandates in school and not, and I've heard from other people at work, some of their towns are pondering the idea of testing, once a week, and I'm not sure where I kind of stand on any of that stuff right at the moment, anyway. So
Right.
rather than commenting on it, I just kind of see where some of the upper level mandates are going to go, and then we can have discussions and figure out what we want to do from there.
Now, the state health department was willing to come to Massac essentially and do or conduct testing. But there is concern as to you've got to get, permissions from families to allow their kids to be tested. Logistically, how would this work? Would they pick like one classroom out of 10 a week? So there was a lot of concern with that, to do some sort of sampling. How would that look at school?
And it opens up such a bigger problem, or potential problem. I shouldn't say an actual problem, but a potential problem. In the fact that, okay, well, now one of those kids
Right.
tests positive. Well, that means everybody that's in that room, or close to everybody in the room, if they're not wearing a mask, and then everybody else that he or she has come into contact. I mean, it just, the randomized testing thing, I don't think I would be in favor of. And
Right.
again, it's obviously not up to me, but that seems kind of silly to me.
Mhm.
If somebody is symptomatic or something like that, yes, remove them, have them tested, and if they test positive, then act accordingly at that point. If they
Right.
test negative, have them out for a day or two and retest, or I don't know. I don't know what the exact answer would be, but I just think this randomized testing thing is just going to be kind of over the top. I think it's an enormous waste of money on top of it.
You know what the thing is there, though? You know how the positivity rate that gets reported all the time,
Mm-hmm.
and if the positivity rate is above 5, it's a concern. So the positivity rate is the percentage of tests performed that are positive. So if tests are only performed on people with symptoms, they're more likely to be positive. So there's more likely to be a higher positivity rate, which makes a higher level of concern. So if, for instance, let's say that everybody going back on a college campus has to be tested, then they're not likely to have a high positivity rate because most people are going to be negative.
Right.
But if only people with symptoms have to be tested, they're going to be likely to only have people that have the problem be positive, right? So they're going to have a high positivity rate. So that's where I kind of joked, but it was a tongue-in-cheek joke, because I I was getting tested every 2 weeks while it was available at the hospital when I was working in the hospital, because I don't work in the hospital anymore. But when I was working in the hospital and testing was available on premises every Tuesday and Friday, I would go every 2 weeks to be tested. And I did it for 3 reasons. One was peace of mind. One was so that I could tell my family I'm negative. And the third was I was doing my part for keeping the positivity rate down because I didn't have any symptoms. I figured I would be negative. And if people weren't getting tested that were negative, the positivity rate was going to be high, which is why I really wish they would just keep reporting cases per 100,000. Because that's where, that's apples to apples, you know?
Right.
When you have a town like Monroe with 19,000 or a town with 6,000 or a city with 600,000.
Right.
If you do cases per 100,000, it's a consistent comparison.
Correct. Statistically,
when you talk about positivity rate, and sometimes you're testing everybody, and sometimes you're only testing sick people. Even if you think about it, like, I don't know right now what Griffin's doing with testing pre-op, but when they were only doing immediate emergency surgeries and then elective surgeries came back, anyone having surgery was being tested, outpatient or inpatient. Then just a couple of months ago, anybody who had had their 2 vaccines didn't have to be tested if they were having outpatient surgery. But if you were going to be admitted overnight, you still had to be tested. So the number of tests performed dropped way down. And obviously, if someone was positive, if their surgery wasn't necessary, it wasn't done. But, you know, the number of surgeries performed, the number of tests performed dropped dramatically when people who were vaccinated didn't have to have it. Basically, it dropped by 70% because 70% of people were vaccinated.
Yeah. We still test everybody. Everybody that's having surgery gets tested, and if they test positive, like you said, if it's an elective thing that can wait, they're out. They wait. If it's something they cannot wait on because it's like a cancer or something like that, then everything goes forward. But obviously, we have to go through all of the COVID positive type situations and protocols in the operating room in order to protect everybody and equipment and all that kind of jazz.
Yeah. You're not having a joint replacement if you're COVID positive.
No. I'm saying, like, if somebody has a cancer or if they have somebody has not gallstones.
Well, maybe not even if they have if they have a prostate cancer, they're not having their surgery today. If they have a bowel obstruction because they have colon cancer, they are.
Right, exactly. And
but they're not having for a
we have
prostate
to,
cancer.
then we do.
Close. Yeah.
Right, exactly.
And they're certainly not going to have a breast reduction.
No.
That's way too elective, No. And it's all for safety of everyone, not only the patient, but for everyone around them. But
absolutely.
With that said, Nancy, we don't have to talk OR anymore. I'm sorry.
That's all right. That's fine.
So the other thing is, the most recent announcements are New London County, Hartford County, New Haven County are the counties that are high as of now.
Mm-hmm.
As of this morning. I don't think it changed by now. I had looked this morning at the website before I went into work. And Bridgeport, Stamford, New Haven, and Hartford mandated masks indoors for any businesses, any public places. Masks are mandated indoors in Bridgeport, Stamford, New Haven, and Hartford. Fairfield County does not have a high rate yet as of this morning. That could change. Who knows?
Okay. So what else did you want me to cover on here, Chris?
Just a little bit of the COVID stuff. So we had a little bit of an update. And is there anything in particular we need to know about the Rotary Club presentation, or is that something that we should just kind of table for now and,
it's, it's just,
have the whole board involved?
oh, it's just an FYI, that's all.
Okay, all right. So let's just hold off on that then.
Yep.
And then
But
if, like you said, like I said, if you can, Nancy, over the next week or two,
Yeah.
if you can kind of think of a couple of items that are of particular interest to you, or items that you feel you need a little bit of help with in kind of figuring out a direction, or should we change this, that, or the other thing, send that as an email to everybody.
Okay.
That way, and then and we can certainly then have a little bit more of a discussion about at least those couple of items, so we have at least a starting place
Okay.
to start having our discussion about the updates and that sort of thing.
Yeah.
As far as what strategic planning we need to go forth with.
Right. And it's very tricky putting strategic plans together. You want them to be a useful document because you're going to be using it for 3 or 4 years. But at the same time, you don't want to go overboard with a ton of meetings and all this either.
Right, exactly. And I certainly don't want to either, and I know nobody else wants to do that either. Which kind of the way I was trying to present it to you earlier, in the different avenues as far as the stakeholders, internal, external, blah 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 type thing. Okay. Is there anything else in particular, Mary, that you want to know about any of the items on the agenda that we kind of breezed over or skipped entirely?
So in general, how are we doing? Are we good with all those things that are usually Board of Health discussions, like septic systems and water quality? And have we had to close the pool or the lake because of water or any of those things? Are those all good?
Those are all good. The only thing really to tell
Okay, that's good.
no, everything's good. The only thing really to say is environmental. We're very busy doing septic system repairs. And we're out there now getting our food service inspection done. And that's pretty, those are the important things that we're on the road. And I did send you guys a calendar of events. Actually, Barb sent it to you. But if I could get feedback from both of you, if you take a look at it, keeping in mind that we have a very small staff and we're trying to get our nurse on by the end of the month. We'll see, so to replace Heather. But so a lot of these things, it depends, they're staff dependent. But we threw something together for you to take a look at. And if you have any other ideas, let me know. We added on here a rabies awareness clinic that we are going to work with the town clerk on in June. So you're going to see a couple things that are new, but other things it's going to be a lot of what we've done before.
Okay, great.
Yep.
Thank you, Nancy, because we know you've been working double time.
The whole staff has been very, very busy, and I have to admit, with this strategic plan, I'm really like, oh, it can be a monster, but at the same time, I want it to be a good future plan for us to follow up on. And Mary, if you get a chance, take a peek at it. Most of the things were done on the plan. There are a couple things that didn't make sense for us to do. It was like more work, jumping through hoops where the outcomes were not worth it. So we just didn't do it. But so I'm just trying to find a strategic direction, and some of the things.
Like I said, I glanced it over, but I did not look at it in detail.
Yep. No, when you get a chance, that's fine.
Yeah.
But I'll put some thoughts together, Chris, and I'll send it out to the board and see if pare it down to a few things.
Yep. A few things at a time.
Yep.
Okay.
All right.
Awesome. Okay. So we're going to call for adjournment. It is officially 6:54. Okay. So thank you very much, you two, for logging in. Barbara, thank you very much for kind of hanging out in the background and taking care of all this stuff for us on. Certainly appreciate it. We are officially adjourned. Thank you.
Thank you.